Hey guys, today I want to talk about how I prepared for health problems. We had one of our subscribers ask me this question. I think the guy's name is Daryl Phillips. Daryl asked me this question and asked me to explain it on here how I prepared for like my health issues. Well, a lot of my health issues have to do with the VA. So the VA takes care of some of those things, okay? And the other things, what I did was I made sure I had health insurance, okay? Because I made sure when I got over here, I got Pacific Cross right away, and that took care of my inpatient needs, but not my outpatient needs. Now, my current income right now helps me pay for outpatient things, and also for it takes care of my prescriptions, things like that. And sometimes they get a little expensive. Like for my legs here, I've noticed I've been spending like $80 a week sometimes for lotions and creams and stuff for my legs to try to get them fully healed. So I take a lot of that on the chin. I have to cover it, and it's not fun when you have to, and it has to come out of your pocket. But also, you can also get outpatient coverage with prescriptions and things like that. You pay a little bit more for it. It's not that expensive, and then the insurance company will reimburse you or whatever. The Pacific Cross. Now, Pacific Cross has many different plans, and you really need to think out where your budget is and your income level is. When I talk income level, or your income coming in and your budget, I consider that kind of like the same. A lot of people don't, because your income has to get budgeted away, whether it's some of it goes to a bank account or to save or whatever. No matter what, it's still getting budgeted out, whether it be to stocks or something. I consider that all budget money. Okay, that's the way I look at it. Okay, now I'm in that sweet spot zone. Okay, the 2 to 3,000 zone. I'm actually a little bit above that now, probably. I'm in a good spot because YouTube has helped me a lot, and some other things that I've done with stocks, things like that. I'm in a good spot, and I'm happy about being in that spot. That kind of gives me that income to help me. Now, with me, I also have other issues too, okay? Because my girlfriend also, she needs some prescriptions. They're expensive. Her prescriptions vary from about 80 to $140 a month for prescriptions. Sorry about that. So that's about where we're at as far as that goes. Okay, but it can run you a few bucks, and that will go away sooner or later when my legs heal up or whatever. And I expect them to probably heal up within the next 3 to 4 months. That'll go away. I'll probably need to use Cetaphil, which is like just a cream, a lotion that you put on your leg and you just rub it in, and it'll probably take care of me after that. With minor flare-ups, I'll probably have to use some other creams, prescription creams on occasion, okay? Now, when you guys come over here, you got to kind of figure out where you're going to be at, because we have people that are coming over here that are pre-diabetic, diabetic. They take metformin, things like that. I also take metformin. Metformin over here is wicked cheap. That's all I can say. It's wicked cheap, okay? That's a Boston term. That's the best way I can say it. It's exceptionally cheap over here for metformin. I buy like a 3-month supply and just pay it all up because it costs almost nothing. I mean, I forget what the price is, but it's very reasonable, okay? And I take it twice a day. These are the things that you have to plan for, okay? I'm pre-diabetic. I'm almost at the level now where I can almost go off the metformin. And if I lose a few more pounds, I can go off the metformin. I've never been diagnosed as having diabetes, but I'm pre-diabetic on the lower scale, okay? Like I'm at like 105, 108, somewhere in there. But lately I've been coming out at, like, even if I don't take the metformin, like 101, 102, 98, 99, somewhere around there. So I'm almost like, I would almost say I'm kind of normal, and I could probably take myself off of that sooner or later. But over here, you need to get exercise to take care of yourself. You need to stay healthy. You need to take care of your skin over here. Your skin, if you see an issue with your skin, let me tell you from my personal experience, do not let it go from a single wound, then turn into another wound and into another wound. Go to a doctor and get it addressed right away, because skin issues over here are going to be one of your big issues over here. And I'm just telling you that from stuff that's happened to me. A little tiny mosquito bite that bit me 5 times in a row. He bit me 5 times on the leg, all in a row, at night, and it was a mosquito. Some people say, well, no, Steve, it might have been a bed bug or something like that. No, it was actually outside that had happened. I remembered when it happened, and those 5 mosquito bites was what caused a lot of my skin issues from then on. I still have those marks on my legs. They've gone away a lot, but I can still see where they were. And I just want people to be aware over here that there's different ways to skin a cat over here as far as your health care. Okay, one of them is having like a large sum of money in the bank for emergency things, and I also have that too. Okay, I have some money in an account that if God forbid something happens and my insurance doesn't pick up all of the costs or whatever, I can dip into that and say, okay, this is what I'm going to do. I also have backup of credit cards, so if I have to go over that, I have the credit cards to go into, which I don't want to use, trust me, but it's just an emergency thing. It's part of risk, is part of being an expat. There's a large level of risk. It takes a lot of, thought to become an expat. And let me tell you something. The only way to put it is, it takes a lot of balls to become an expat and live in another country. I hate to use those words, but that's the only. It's the only way to explain it. It truly is. I give people a lot of credit when they become an expat, because it takes a lot to get up and leave everything behind and step into a whole new world and start off from scratch, especially in our years, in our 50s, 60s, 70s, and even into our 80s. Some guys are coming over here and they're starting their lives over. And I give a lot of people credit for that, where credit is due, because it's not easy coming over here and starting from scratch. And some of these guys, they've had Medicare. They're giving up a lot of that stuff back in the States, a lot of healthcare back home. They're giving it up and coming over here, and it's a big risk unless you have the money to do it. The younger you are, the cheaper your insurance is going to be. If you're coming over here in your 70s, don't come over here on, if you're sickly and stuff like that, and you're coming over on 800. I keep going into that, and a lot of people don't listen to me. They come over here and they say, well, I'll deal with it because the healthcare in the Philippines is cheaper. Yes, it is, but it can also get very expensive if you need long-term healthcare, and it'll eat away and whittle away your emergency fund or whatever, unless you have some sort of healthcare. And your healthcare might be a little bit more because of pre-existing conditions or whatever, or they might not even want to touch you with pre-existing conditions, because of those pre-existing conditions might cost them too much money to shell out money for you, so they might not even want to work with you. So I just want to put that out there. I've done a lot of videos on healthcare before on the different insurance companies. Watch those videos if you want to do like Pacific Cross. There's also Pacific Prime. We've talked about Pacific Prime. Pacific Prime is a brokerage firm. I did a video on that way back. I have like about 800 videos, so you're gonna have to sort through those. But you can find a link in there that will tell you how to get in touch with Lana. Lana's very good at what she does. She can get you 10 different quotes from 10 different insurance companies through Pacific Prime, or you can go online and look them up yourself. You type in what type of insurance you're looking for. You don't need $1 million worth of the insurance. You need about $250,000, maybe $150,000 worth of insurance, something like that. But I would tell you at least do $250,000, $300,000 just to be safe, and that'll pretty much cover you in any country except for the U.S. Okay, so you need to tell them what exactly you want. They'll break it down and find companies that will insure you the way you want to be insured. Okay, and then it goes from there. So that's really, really good. But Pacific Prime is, like I said, it's a brokerage firm. Pacific Cross is an actual company, okay? And Pacific Cross is one of the Philippine companies over here that's a really good company. Some people like them, some people don't. They do have American plans where they pay higher levels of insurance. You can hear my friend the Rooster here coming over from the mayor's house. Comes over to visit me quite often, unfortunately. But anyway, guys, I wanted to throw that out there to you guys, and I want to thank Daryl for sending me that question. I hope that helps you guys. That's how I deal with it. A lot of it's out of pocket for me. Some of you guys that are coming over here on the lower budgets, you need to have backup. You need to make sure that you have enough to cover you when those things kick in. If you have a girlfriend that has health care costs and for prescriptions and they're costly, $800 is not going to be enough for you. I'm telling you right now, my costs sometimes at $80 a week would eat up an $800 budget in no time at all. You'd have no money left. So be careful, guys. God bless. Take care. And enjoy your new year, guys.